Hello everyone, my name is Priya and today I'll be talking about infectious mononucleosis. Um, Typical patient presentation: a 17-year-old male presents with early flu-like symptoms, which would be fever. He complains of having a sore throat and enlarged lymph nodes in his neck, followed by fatigue. A blood test reveals elevated number of atypical lymphocytes. Atypical lymphocytes are basically activated lymphocytes in response to infection in the body. Moreover, further tests reveal thick exudate covering his tonsils. Exudates are the secretions from the tonsils in response to inflammation or infection in the body. Etiology of the disease: Epstein-Barr virus (EBV), which is the most common cause of mononucleosis. EBV is an infectious disease which commonly presents with early flu-like symptoms such as fever and fatigue. It is generally transmitted through bodily fluids, usually the saliva. X-linked lymphoproliferative syndrome, which is the exaggerated immune system response due to Epstein-Barr virus. It is a disorder of the immune system and could cause life-threatening reactions, such as the destruction of blood-producing cells in the bone marrow. Autoimmune disease: overproduction and accumulation of lymphocytes, which is also due to exaggerated immune response, such as lymphoproliferative syndromes and lymphocytic interstitial pneumonia, which could cause cough and dyspnea and could possibly progress to respiratory failure. Cancer: EBV is linked with a higher risk of lymphoma or lymphatic system cancer due to the accumulation of lymphocytes causing mutations within the cells, which leads to the production of the cancer cells. Infectious mononucleosis is quite common in the society, with an overall incidence rate of about 5 cases per 1,000 people per year. Moreover, an estimated incidence for age 15 to 19 ranges from about 200 to 800 cases per 100,000 in the United States. Majority of the people might just be a carrier of the disease rather than being symptomatic. Risk factors of infectious mononucleosis: the disease occurs in individuals from age 15 to 35. The peak incidence in the male population is comparatively early to the female population. As in the males, the highest incidence is during the adolescence period, whereas in the females, it is between the ages of 18 to 24. The most common cause of developing mononucleosis is Epstein-Barr virus or EBV. As the disease transmits through bodily fluids, it is also called the kissing disease, which is a result that the highest incidence is during the teenage years. Moreover, immunosuppression are also a great risk factor for developing mononucleosis, as after the surgery, the body is more susceptible to an infection as the immune system is not being able to actively eliminate the pathogen. Pathophysiology of the disease: the replication of the virus occurs in the nasopharyngeal epithelium, which is the upper part of the throat behind the nose, causing abnormal lymphocytes in the peripheral blood, which is due to the accumulation of atypical or activated lymphocytes as a result of an infection. As the virus replicates in the nasopharyngeal epithelium, viral genome can be detected in the oral cavity prior to the early symptoms. Moreover, the infection decreases B cell stimulation, which causes more replication of the latent EBV infected B cells. The most common symptoms of infectious mononucleosis include headache, sore throat or pharyngitis, fever, malaise, which is the feeling of discomfort, joint pain, fatigue, swollen lymph nodes in the neck and armpits due to an infection, and rash. The picture on the left shows an individual with infectious mononucleosis as their tonsils are covered in exudate, which are the white yellowish secretions which are coating the tonsils. The picture on the right compares a normal throat with a infected throat, and the main difference is the enlarged tonsils with exudate. Here's another picture of exudative pharyngitis where you can visibly see the yellow-white exudate coating on the tonsils. On the other hand, the pictures on the right compare chest x-rays of a normal individual to an individual with lymphoma or lymphatic system cancer. As you can see, the points where the red arrows are pointing at, it looks more hazy and cloudy compared to the normal chest x-ray. Those are the location where lymph nodes are present in the mediastinum. Due to the infection, the lymphocytes are accumulated in those lymph nodes, causing them to replicate frequently, causing cancerous cells replication, which eventually results in lymphatic system cancer. Diagnosis of the disease: thick exudate secretion, which is the whitish, yellowish, grayish coating on the tonsils. Positive heterophil antibody reaction, which is a specific antibody test for Epstein-Barr virus infection. Higher rates of antibodies for EBV antigen, the antibodies created by the immune system in response to EBV for the diagnosis of mononucleosis due to Epstein-Barr virus, as we know that the major cause or risk factor of infectious mononucleosis is Epstein-Barr virus. So the antibody test is essential and helpful in the diagnosis of the disease. People with mononucleosis would have 103 degrees Fahrenheit fever, which would gradually get normal within 7 to 10 days. On the other hand, children with the disease would probably not have a fever at all or have low-grade fever. In a blood test, atypical lymphocytes could be found, which could be defined or evaluated from their appearances as abundant basophilic cytoplasm, which generally means bigger cytoplasm, and larger nucleus with prominent nuclei, which could be seen on the picture on the left. Treatments for mononucleosis: as the disease is self-limiting, it doesn't usually require treatment. However, symptomatic patients could use non-steroidal anti-inflammatory drugs for sore throat, fever, fatigue, and other common symptoms. Limiting physical activities could be helpful during the acute stages of the disease in order to reduce the risk of splenic rupture. Immunosuppression reduction in patients with organ transplant could be beneficial in order to fight off the infection or possible pathogens.